Hey guys, it's Nicole and this is my monthly Capella video. As always, I'm a sponsored FlexPath student and I am 2 classes away from getting my MBA and I am beyond excited. One of you viewers out there asked me what was the moment that made me think I needed to get an MBA. As a bedside nurse, it was something that I had always thought about, but leadership was really focused on the budgets and the financial aspect of healthcare. That is something that I understand. If we only have funding for one x-ray machine, do we get an x-ray machine or do we hire more nurses? And you have to really evaluate those outcomes. That was something that, as a bedside nurse, I felt like I was out of the loop on. How do you properly assess if increasing your workforce is going to help your community more versus an x-ray machine? That is something that I learned in my MBA, how to see those outcomes of those investments and how they're going to impact your community. As a bedside nurse, I didn't think it was really fair for leadership to be the only ones making those decisions. I felt like maybe we needed a shared governance in some way, and I really wanted my input. And I felt like having that MBA would give me the information that I needed to become a voice, to speak up in my community. You know, it's one thing to have an idea. We need more nurses. Great. But if your infrastructure can't support and pay for those nurses, you aren't going to have them. So you're going to have to allocate those funds from other places. So the MBA has really helped me to understand if I want something, I have to present the proper paperwork. I have to do the proper investigation to help my community. If I want to start a diabetic program, what community would be best? What county would see the biggest impact? What demographic would see the biggest impact? It's one thing, again, to have a really great idea, but if you're trying to help the most people that you can with the smallest budget, you have to do your research, and that's where my MBA comes in. I'm able to do financial ratios, create business plans, look at census and find out, Osceola County has the highest rate of cardiac death versus Orange County. These are things that you have to look into when you're building a new hospital. You want to have the biggest local impact. Why is this hospital built down the road versus 3 miles away? There's reasons for that. There's surveys that, disclose some interesting information. And I want to be a part of that kind of leadership in that team. As tough as MBA has been, I'm 2 classes away. And again, it's just opened my eyes to why leadership does what they do. And I want to be a part of that. I love nursing. I'll never leave it. But again, I want to help my community with the biggest impact possible. And that starts on that kind of level of understanding who makes the decisions and why. This month has been very stressful for me as a student. I'm in my accounting class and it's not something that comes second nature to me. I had to read up a lot, but my instructors have been nice. My advisors have been amazing. And again, I'm almost done. Another interesting month. I love Capella so much that I'm applying for my doctorate there, and I haven't heard back yet, but keep your fingers crossed for me. I'm very excited. This is a non-sponsored situation, so I'm paying out of pocket for this, but I love them that much, so stay tuned for that. But as always, questions or comments, put them below, but I'm learning a lot. I'm expanding my mind. I'm growing as a person and a provider and really just a human being. I've learned to listen to people more and kind of dive into what they want. If you want, free medication in this local area, if you want insulin to be free, who do I need to talk to? How do I get that done? How can I present the evidence that is needed to get my patients what they need? And this is what this MBA is giving me. And I really didn't think that it would, business and healthcare, but they go hand in hand sometimes, and I've learned a lot. Anyway, questions or comments, as always, put them below. Thanks for watching, and I'll see you next month. Bye.